Good morning. My name is Manoj Krishna and I'm a spinal surgeon. Today I want to tell you a story about a patient of mine who presented with severe headaches. All the scans of his brain and vertebral arteries were normal. An MRI scan of the neck showed degenerative discs at two levels with one bulging backwards. He had no neck pain. I operated on him and did an anterior cervical decompression and disc replacement at both those levels. His headaches disappeared. This suggests that many patients with headaches of unknown origin could actually have an easily treatable neck problem, and it represents a renewed hope for these patients. These x-rays show the disc replacements at these two levels. The operation takes about an hour to do. Here's Alastair in his own words. Morning, Alastair.
Morning, Mr. Krishna.
Let's start by telling me how old you are.
I'm 37.
Okay. And you work, what sort of work do you do?
I work in a lab and sort of office-based, about 50-50.
Okay. Tell me a story about your neck and headache problem.
Okay, so I started back in May 2011 with headaches.
Okay. And it's currently, what are we, March 2012. So
yes.
Okay.
So the headaches were constantly at the back of my head, and I initially, after seeing my GP, was referred to a neurologist where they did a brain scan for any tumours, and that came back clear. I then had another scan which looked at the arteries going to the brain, and from that they concluded that I'd probably got a vertebral artery dissection.
Right.
So I was told that often that's not normally found until after a person has had a stroke. So I was sort of really pleased that they'd found it prior to then. So I was told that I could have the headaches for about 2 months. But as the 2 months progressed, the pain in my head at the back just constantly got worse and worse. And then they repeated, sort of coming up to 2 months, repeated the scan on the arteries again, and there wasn't any change, but the pain had obviously got worse. So then they did a CT scan, and from the CT scan they concluded that I probably didn't have an artery dissection. So the next step was I had a lumbar puncture to check for meningitis, but I wasn't showing any other symptoms, so then I was referred to a second neurologist who basically just thought I had chronic headache, and it says that thought that I was taking too many analgesics, but I'd only ever taken what I'd been prescribed by my GP. And so he told me just to stop all the painkillers, which I did, and within 2 days I was just in absolute agony. Had the emergency GP out at a weekend, which I've never done before, and it was then that he suggested that the pain actually could come from my neck. So
and who was it, your GP suggested? Or
this was just the emergency GP.
The emergency GP suggested it?
Yeah,
right.
So then I went to see my GP, and he agreed to send me for an MRI scan on my neck, and then it was when that come back that they said I had some minor bulging in my discs, but I wasn't happy with that, and so I'd heard of Mr. Krishna and asked to be referred for him to look.
How do these headaches affect you and your quality of life?
Well, basically, initially, when I first started, it was just a constant headache at the back. So I've suffered migraines, but the pain then wasn't too bad, but just constant. And then as it got worse and worse, and before, leading up to seeing Mr. Krishna, I got to the stage where I was basically laid flat down in bed, face down, and then I was just getting up at meal times for meals, because that was the only way that I could sort of relieve any of the pain.
Gosh, and you were off work as well?
I was off work from the beginning of May.
Golly, that's a long time.
So, and then initially had Mr. Krishna suggested having the facet joint injections, which I had 6 injections into the back of my neck, and I'd heard a story from somebody else that had them, said they'd be quite uncomfortable, but at the time, don't worry about it, because if it relieves the pain, I'm prepared to go through it. And I had the injections up at Nuffield Tees, and I had the sedation, and the next thing I know, I was waking up in recovery, and I didn't even know I'd had the injections.
Right.
So, that was amazing already. But unfortunately, the injections didn't seem to work. I had a bit of initial relief from the pain, presumably just from the anaesthetic. So then the next stage was Mr. Krishna suggested having surgery.
So you had a cervical disc replacement at 2 levels.
Yes.
Because the MRI showed 2 worn discs, and we did a disc replacement in November.
Yes.
So that's
November the 4th.
Okay, so it's about 4 months ago.
Yes.
So tell me a story about the surgery, your recovery, and then how you are now.
Okay, so I went into hospital on the 4th of November, had the surgery sort of middle of the afternoon, and then by the evening I was sat up in bed and I was actually eating. So I'd been told that from the surgery that he could have some difficulty swallowing. That I had for just a couple of days, and within a week I was completely back to normal with swallowing.
Okay.
Obviously after the surgery I was sat up in bed straight away, which was something I hadn't been able to do for the last couple of months. So, and then, after the surgery, I guess my head felt a bit as though it had been pulled out of my sort of shoulders stretched, and so although I didn't have any sort of the headaches, I did have a bit of soreness around the neck. But then for the next, I would say, I did have some physio as well, but for the next 2 to 3 months, every day I noticed an improvement, and the movement in my neck improved, and say now I'm virtually back to normal.
What about your headaches?
The headaches have completely gone.
Now that's pretty remarkable, because we're only now beginning to understand that degenerative discs in the neck can cause headaches without causing much neck pain.
Yes.
Because you didn't have much neck pain at all.
No, I've never really suffered with any major neck pain. Occasionally, if I spent a full day at a computer or something, I get a bit of stiffness in my neck, but no real sort of pain in my neck.
And show me